Hi, my name is Ashley, and I decided to do my rural health project on care coordination in the rural setting. I chose care coordination because I feel that it is important to provide equal care amongst urban populations as far comparatively to rural populations. And that is quite a concern at this point in healthcare. There is significant disparities amongst the rural population as far as access to care. So they're limited on specialties that are available to them, limited to maybe technology and equipment, limited to specialty care or supplemental care, such as like physical therapy and things such as that. Also, further than that, um, doctors are limited, providers are limited, but nursing staff in the hospitals, respiratory therapists, um, you just don't have the bodies like you would in an urban setting. And then another disparity that you see in the rural setting based on um, limited access to care. Um, a lot of times it's communicated or understood as non-compliance, but really, if you think about it, if you really kind of delve into the issues at hand amongst the rural population, they really have an inability to follow the prescribed regimen or the provider's suggested home care. It's difficult or problematic to follow follow-up schedules. You know, if you have to drive 100 miles to see your provider and your provider wants to see you monthly, that's going to be an issue. Whether it be just distance or maybe you don't have reliable transportation or the financial means to pay for gas. Those all things are things that need to be calculated into the whole equation. Okay, and here, if we're going to be coordinating care, we're going to need to conduct a community needs assessment. For that, I would be gathering data from local community sources, whether that be churches, schools, law enforcement agencies. Also, talk to the hospitals, health department, nonprofit organizations. You want to gather as much information about the local population as possible. What are their needs? What are their financial means? What is holding them back from healthcare? Also, uh, I'm going to gather demographic information from maybe the latest census report or health data without violating HIPAA, of course. Um, you want to also check with the rural population or maybe the healthcare providers to see kind of how the knowledge is, what kind of education needs are there as a general population to kind of give you a basis of what is really necessary for that region. Okay, goals of the program I see would be to identify gaps in available healthcare, implementing plans to improve upon current availability, and then plan for future growth. How is that community going to change over time? And how are those needs going to change over time? Things like that. Now, the overall target population, rural health in general, some of the things that you see, characteristics you're going to see. Overall, you're going to see a lot of farming, so that brings you to lower education levels. When you have farmland, you're most likely going to be further away from healthcare providers or hospitals. You're going to have lower incomes generally with farming, and even not farming, you're just going to see lower income levels in the rural population. Um, they may be self-employed or not be able to afford insurance, so that's going to be an issue. Um, then also in the rural population, you do see more substance abuse as well, whether it be either smoking tobacco or illegal recreational drugs, alcohol, excuse me, um, things like that. You're also going to see more chronic diseases. Some of that might be related to environmental hazards, or some of that might be just because it's been a chronic issue of not receiving health care in a timely fashion. And so those chronic illnesses are able to worsen in a shorter amount of time. Needs that we see in general in the rural population are financial assistance, maybe with travel, medications, various needs there. Transportation, you're not going to see public access to transportation as much or at all really in the rural population. Um, with the increased substance abuse, there's an increased need for counseling for cessation, help with that, maybe providing medications, patches, things like that. And then also filling the needs of the knowledge base, education promotion on healthcare and health in general. Work ethics, a big value for them. They also like to depend on themselves instead of depending on someone else. They like to be independent, and they like to be free and not felt like they're held down by some sort of rigid standards set forth by an outside party. Some interventions that I see in the cultural adaptations. We could have home health nurses providing routine checkups in between less frequent doctor visits to accommodate their need to work, because that's their culture, work, um, morning to night, 7 days a week. They're harvesting, or they're planting, or they're doing things like that, and we need to work and accommodate that. Cognitive adaptations, apply education to improved ability to work. Um, Effective motivational adaptation, host health clinic at a convenient time. Um, set it so it's not going to interfere um, with their work more so than activities they already have in place. So maybe right after church on a Sunday to avoid an additional interruption. Maybe host it at the church or in the a community hall nearby, things like that. Further interventions, environmental adaptation, education on protecting airway from harmful chemicals, provide protective masks, because that is going to be one way that they're affecting their lungs and creating more chronic disease, or at least worsening potential COPD that they've had from long-term smoking, things like that. Cessation counseling for various substances, for certain individuals, adaptations of program content, use basic verbiage during healthcare promotion or patient education, so they understand. You're not going to want to use big medical terminology that doesn't make sense. It's kind of like a foreign language. Also, adaptations of the program form. Survey rural dwellers in specific local towns to assess for preferred adaptations to improve efficacy. Make sure you're communicating with the people that you're trying to target, making sure that you're on the same page as them. Implementations, that I see would benefit this program greatly. Relationships with community partners. Work with the local churches, because a lot of these people are, that's their big thing. Besides working, their priority is church. Where God's big in in their lives. Also, FFA, the Future Farmers of America, local high school. Get a hold of these high school students before they go into adulthood and promote health. Make sure that they're aware of these environmental hazards or the dangers of smoking, or etc. There's tons of things that you could address with high school students that um, getting ahead of the game would be extremely beneficial. Recruitment and supervision of program staff, clinical and non-clinical needs. You're going to need nurses. You're also going to need like caseworkers, just receptionists, people that are going to do paperwork, things along those lines. Healthcare provider shortages is an issue. So what are you going to plan to combat that concern throughout this program? Making sure that you're not shorting somebody else. Staff retention. What are you paying? Is the pay adequate? Acceptable workload? So don't expect crazy overtime hours, traveling hundreds of miles a day for little pay, too much patient load. You need to take these into account. Training for staff. You want to make sure that you cover HIPAA, chronic disease management, cultural competence, effective communication, and then continuing education. These are important. And then liability, staff driving throughout their shifts, staff entering clients' private residences, oftentimes huge liability issues there. Potential challenges with implementation, loss of financial support of individual outreach programs, inability to keep staff members and or keep their education up to date and relevant to the target population. Keeping those in mind while you're setting the program structure. What would the potential study design be? Non-experimental design. I believe that this design would be best because the entire program is based on human behaviors and human reactions. Control group not available and outcomes will vary greatly. Potential framework used to evaluate your program would be an impact evaluation. Outcomes is the big one. What kind of goals are you setting, and are you reaching those goals? Additionally, the impact of members of the target population will be measured and documented as well. Sustainability strategies, fundraising and contributions, partner organizations, grants, contracts, communicating success of the program to rural community members, stakeholders, making sure everybody's aware that you're succeeding so they want to financially keep supporting these programs. Potential funding partners, National Rural Health Association, CDC, and other foundations are available as well. Methods of dissemination, communicating your evaluation data. You want to make sure insurance companies are available or have this information available. Providers that are prescribing these supplemental programs to their patients, they need to know that this is successful and it's helping and making a difference in these patients' outcomes. Key audience. Evaluation data reported to insurance providers, like I said, collaborate with physicians or other direct providers. And then there's my references. Thank you.